Mr. Rouzer, we're going to go back to you for two questions, sir. The first one being, what is your vision for the future of Social Security?
Well, we must preserve and protect Social Security for the long term. The more immediate crisis is Medicare. Medicare goes bankrupt in 12 years. But specifically regarding Social Security, we need to make sure that our commitment to our seniors stays in place. And I do not recollect exactly when Social Security runs out of money. I know Medicare goes bankrupt before Social Security does. But the fact of the matter is we need to tackle both of these problems head on and put forward solutions and have a dialogue with the American people about how we want to proceed on both. Without question, all the money that has been put into Social Security by individuals such as my parents, including myself and all those in the working community, they need to have Social Security. That commitment needs to be kept. And so I will do everything possible to make sure that we protect and preserve Social Security for the long term.
I want to play off that, excuse me, sir. I want to play off that a little bit because there are several different kind of plans out there, and in past forums you have discussed favoring some versus the others or parts of some. Can you let the audience know a little bit now what you favor, such as the different budgeting plans that might save Social Security or keep Social Security solvent?
Well, we haven't discussed Social Security in any public forum that I'm aware of. Most of the focus has been on Medicare and how you solve and protect and preserve Medicare for the future. But obviously, Social Security is a system where workers are paying in currently, and that money that's being paid in is going to beneficiaries. We have a lot more seniors, a lot of baby boomers that are retiring, and we have fewer workers. And so, long term, the program needs to be adjusted. Otherwise, taxes are going to increase dramatically, or benefits are going to be reduced dramatically. And that's a discussion, that political leaders need to have with the American people. Have a very straightforward dialogue so that we can preserve and protect the program long term.
Thank you, sir. Now, the second question to you has to do with a recent Congressional Budget Office analysis that estimates the first stimulus package, ARRA, if you will cost $814 billion. Unemployment in North Carolina, though, and many counties right here in the 7th Congressional District still is over double digits. Question, would you vote for a second stimulus package if it came to a vote in the United States House of Representatives?
No, I would not. And there's a fundamental principle that all of my votes would be cast based on, and that is less government spending and lower taxes create jobs, not more government spending. The more you take from the private sector, the more you take in terms of dollars, in terms of taxes, from individuals, from a family budget, a small business budget, family farmers, that's one less dollar that they have to reinvest in their business. It's one less dollar they have to hire new employees, or much less keep the ones that they're trying to keep. So that's just a fundamental principle. If we want to grow the economy, let's get the federal government out of the way, and let's let our entrepreneurs and individuals who are creating new products and new ideas, let's unleash them and let them do what they do best, and that's create jobs.
Thank you, sir. We'll move back to the County Commission. Thank you, Mr. Ballard. Mr. Rouzer, let's go back to you for a couple of questions, if we can, sir. Federal unfunded mandates cause a pretty big impact on state and on local governments. Everybody sitting up here is shaking their head. What would you do if elected to Congress to try to bring these mandates under control?
Well, quite honestly, we need to get rid of them. Serving in the state legislature, anytime I was trying to do anything to move the ball forward, whether it was to, I think a light blew out there.
I think you're right.
Too much hot air up here.
We'll leave that one alone, Mr. Rouzer. Go ahead, continue.
The federal government needs to get out of the way of the states and local government. And when I was pushing welfare reform, requiring, and I introduced a bill to require welfare recipients to pass a drug test. One of the reasons why that gets stuck in every state legislature is because of the federal government. There are a number of issues where the federal government gets in the way. If you're trying to reform and make modifications to Medicaid, you can't do the things you need to do because the federal government has rules and regulations in place that prevent you from doing what you need to do. So we need to get the federal government out of the way, delegate those things to the states and the local entities, and let them do as they see fit best for their folks back home.
Okay, sir, we're going to ask you one more question, and it has to deal with the Healthcare Reform Act of 2011. Needless to say, it has caused division among voters in this country. A two-part question, I guess. Do you think the current law, the Healthcare Reform Act, is sufficient? If not, what would you offer as an alternative?
Well, we need to repeal Obamacare. There's absolutely no question about it. Obamacare is one of the biggest drags on the U.S. economy today. There are a number of businesses out there that are trying to figure out their future. They're trying to figure out how they're going to make it under the mandates with Obamacare. In fact, King's Restaurant there in Kinston, North Carolina, many of you probably have passed through there, he's faced with a $120,000 penalty under Obamacare, and he's looking at shutting his doors. That restaurant is an institution in that community. And that's just one example all across this great land. Well, now, what do? We have to understand why healthcare is such a problem that it is. It's because of the increased cost. Why are costs increasing so much? You have no transparency and you do not have enough competition. The doctor's office is about the only place you go where there's no price list. We have to put in place free market solutions that bring about more transparency and more competition. And when we do that, that will begin to drive costs down, making health insurance more affordable and accessible to everyone.
Thank you, sir. Back to the county commission candidates. Mr. Williams, thank you. Mr. Rouzer, back to you for a couple of questions, sir. And you mentioned this earlier about losing doctors who will accept Medicare patients. Question, how do you propose the Medicare solvency issue so senior citizens can have access, and specifically access to physicians who continue to accept Medicare?
Well, we have to understand why physicians left and right are dropping Medicare patients and refusing to take new Medicare patients. It's because the reimbursement rate is so little that they can barely keep the lights on. That's the honest truth. You know, and that's how government works. When you have a government program, everything's about the dollar. And if you look at the politics of it, there are far more beneficiaries than there are physicians. So the first folks that they go to cut are the physicians. But you know, that's not helping the beneficiaries. That's not helping anybody who's a senior citizen when you have a need and you try to go and get that need addressed and you can't find a doctor who's willing to take Medicare. Under Obamacare, they took $716 billion out of Medicare to help fund Obamacare. So if we're going to fix the Medicare issue long term, number one, we don't need to be taking money away from Medicare. And I'm here to tell you, I'm not going to touch one penny from any senior citizen. I'm not going to take one dime from any senior citizen and take away their Medicare at all.
Thank you,
even
sir.
under the Ryan plan.
Thank you. Thank you, sir.
I'll get to that in a minute.
I'm going to move on to immigration reform. And again, you have 60 seconds. You can use it in any way that you would like. Do you support comprehensive immigration reform policies, such as the law enacted in Arizona?
Well, I certainly support the law in Arizona. Arizona is unique in that it's a border state, and that is a difficult situation there. When you leave a problem unaddressed for 30 plus years, the criminal element always follows. And the way we're going to fix this is we're going to secure the border. I've signed the border security pledge, and I am absolutely committed to securing our border. The other thing we have to do, though, to secure the border is we have to address the demand issue. And the way you do that is you put in place worker visa programs, guest worker programs, where workers can come and do the work and then they go home. Put in place programs that employers can actually use. And when you do that, guess what? It takes all that pressure off the border, and we can focus on those who are here for the wrong reasons and get them out of here and get them out of here fast.
Thank you, sir. Back to the county.